Oh, hello there. Just confirm your name for me. Okay. Make yourself comfortable. You're here for the tooth extraction, aren't you? Okay. You just take a seat there, my lovely. With you in a second. Just having a quick flick through what's happened to you. Okay. So you've broken a tooth. But it's very sharp, it's very sore, lots of pain, bleeding, okay. Okay, so I've got down on my notes here that you're an anxious person when it comes to the dentist. Okay, it's not uncommon. Alright. You don't like needles much, okay. Well, my name's Sarah, and I'm the dental surgeon who'll be taking care of you today. Alright? I don't want you to be anxious or worried. I'm going to keep you nice and calm. Okay. Right. Let's pop that down there. Okay. So firstly, I just want to check your jaw, if I may. Okay. Just pop my fingers there. Just open and close your jaw for me. That's perfect. Just move it from side to side. Okay. I'm just going to have a little feel around underneath your chin. Any pain or tenderness there? Okay. Now, we did check to make sure that you've not had anything to eat or drink for the past several hours. Okay, that's fine. What I'd like to do today to help you relax before the procedure, is just to give you a little bit of nitrous oxide, if that's all right. Okay, so what will happen, I'll just pop this mask, okay, over your nose, very gently, and I'll just ask you to take in a few breaths, okay? And the gas will make you feel very relaxed, maybe a little bit giggly. Okay. Yeah. And then we can carry on with the procedure. Is that all right? Okay, I've checked your medical history and you're not on any other medication, so this will be fine. Be absolutely certain you've not had anything to eat or drink. All right. Okay, that's wonderful. So before I do anything, my lovely, I'll need to take a little look around in your mouth, if I may. Okay, so what I need to do is just open nice and wide for me, okay? And we'll get this tooth gone for you. Sounds like it needs to come out now, okay? Alright, okay, nice and wide for me. Okay, lovely, thank you. Okay. Oh, I can see, yes, it's not a big tooth, it's just down there, isn't it? Oh yeah. Alright. Not painful. Okay. I'm just going to have another look around. Just the rest to make sure everything else is okay. Okay. Nice and wide for me. Perfect. Okay. Just a little look around at the top there. Okay. Everything else seems in good order. When was your last dental examination? Okay, so just a couple of months ago. I can tell you do look after your teeth, so that's good. It's just unfortunate that this one has broken like that, and I think it does look very loose. So rather than try and repair it, I think it's best that we do remove that. Okay. Okay. Just relax there a second. Okay. Right. So I am going to give you some local anaesthesia today. Alright. But as I said, I'm going to let you breathe through this mask first. Okay. So I'm going to let you take a few little breaths first without any gas. Alright? Just so you can get used to the feel of the mask on your face. Okay, so there we go. Very gently there. Okay, now just take some nice breaths in and out. And in and out. Okay, lovely. How does that feel for you? Okay. Alright, I'll just breathe normally for a while. Okay. Alright. There we go. Just going to push that on a little bit further now. Okay. There we go. A little bit firmer pressure. Is that alright for you? Good, good. Okay. Right. Just going to put some oxygen through it now. Alright. Okay. And just keep breathing for me. Right there. Okay, this is just oxygen for now. Alright. You're okay. It's alright. Okay, I'm just going to pop a little bit of the nice gas through now. Alright. Okay. Just breathe. A few breaths for me. That's perfect. That's perfect. Okay. Right then. Are you feeling a little bit lightheaded and nice? That's good. Okay, right. I'm just going to remove that for a second. Okay. Right. Just going to get a little bit of local anaesthesia. Okay. While you're nice and relaxed. And now open nice and wide for you, my lovely. You okay there? Good. Feeling relaxed. Wonderful. Nice and wide for me. There we go. I'm just going to pop a few little drops in, little sharp scratch, my lovely. Okay. There we go. And again. And again. Well done. You're doing really, really well. Okay. Okay. Just going to have a look again now. Okay. I'm just going to do a few little taps around the area. Can you just tell me if it feels uncomfortable, or you can feel anything at all, or it's painful? Okay. Okay. Alright, can you feel any of this? Alright. A little bit there? Okay. Let's just give you just a little bit more then. Nice and wide, thank you. There we go. You're doing alright. Good, good. Okay. Right, can you feel this? No? This? all nice and numb. Perfect. Okay. Right. So now you're nice and numb, I'd just like for you to just have a few more breaths. Are you okay? Perfect, there we go. That's wonderful. Just some nice breaths. Okay. Wonderful. Okay. Let's just pop that there. Alright. Just going to pop something round you. There we go. Perfect. Keep you nice and covered up. Not that there's going to be any mess, of course, but just procedure. Okay. Right. Let's just have one little look at that before I go ahead. Are you okay there? Feeling a bit giggly? That's wonderful. Okay, nice and wide, my lovely, thank you. Okay. Alrighty. Okay. Right. Are you ready for me to get rid of this tooth? I bet you are. Okay. Let's go. Alright then. Okay. Now, just open nice and wide for me. I'm just going to be pulling on the tooth a little. You're going to hear a few little weird noises, okay, and you're going to feel the pressure of me pulling, but you shouldn't feel any pain whatsoever. Okay, my lovely. If you do, just put up your hand. Okay, so are you feeling okay? Nice and relaxed. Wonderful, that's wonderful. Okay then, so let's go. Alright then, just in there. Okay. Right, okay. So you're just going to feel me pulling a little. Nice and wide there. Keep nice and still for me. Okay. There we go. Okay. Right. That's got that. Let me just have a little look. Yeah, there's a little feel around there. Yeah, that's good. Right then. That didn't take long, did it? It wasn't very much. Okay, sweetheart, can you just bite down on this for me? Really, really hard. Okay, that's perfect. You keep biting down on that for me for a few moments. All right. Okay. All right. I'll get your notes updated on the computer afterwards. Because this is an emergency appointment, I just wanted to get this down and then we'll update it later. Okay. You can nod your head. Are you feeling all right? Right, let's just take a little look now. Okay, just bite on it for a little bit longer. Alright, there we go. I know it's a little bit difficult to bite when you're numb, but just bite as hard as you can. Okay. take another look now. Another close look, nice and wide, thank you. Let me just give you a little bit of suction there. Okay, just going to come in with a little bit of suction. Okay, there we go. Better, isn't it? There. Nice and wide again, my lovely, thank you. Just going to check the teeth around it now. Okay, that's all looking good. Okay. Absolutely wonderful there. Okay. Just another bite down with this now for me, thank you. There we go. Keep biting for me, that's wonderful. Okay. So I need you to do salt rinses, so just dissolve a couple of teaspoons of salt water into a glass. Okay, slightly lukewarm water, not cold water, not hot water. Okay, and give that a rinse round a few times a day for 7 days. Okay, very, very gently though. Okay, don't eat on it. What we need to happen is the blood congeal and form a clot over that socket. Okay, but we don't want it to become a dry socket because they get very painful, they get infected. So it's just care for the next several days. We'll give you a leaflet before you leave anyway. Okay. Yeah, just be very careful. For the next few hours, don't have anything hot to drink or don't eat on that side. Alright, okay. So, let's just pull that out. That's looking grand. Absolutely grand. Let's give you a little bit more suction, okay. There we go. Make that more comfortable for you. Okay. Right. Just take a very little sip of this. Okay, just to freshen the mouth. Try not to rinse it round that area too much. Okay, just there we go, a little sip. Okay. Okay. And in there. Perfect. Just freshen your mouth up a little bit, won't it? There we go. Okay. So let's just have one last check round there. Are you feeling okay? You're not feeling dizzy or anything like that? No, okay, that's wonderful. That's perfect. Okay, so how are you getting home today? Alright, okay, somebody's with you, that's perfect. Absolutely perfect. Okay, so I'm happy with that. So let's give you a little wipe off. Okay, remove the tissue from around you. That's wonderful. Okay, we'll give you some of these little plugs to take away with you. You might find it weeps for a couple of days. Okay, a little bit of blood coming out. If it starts to bleed a lot, please just call us and come back. Okay, the anaesthesia should wear off in the next couple of hours. Alright, so you're probably going to feel a little bit of pain, so just take some painkillers, but it's all in the leaflet we're going to give you. Okay, so I need to ask you to leave biting on this again, okay? Alright, got a nice fresh one for you here. There you go. You bite down on that. That's wonderful. Okay, so as long as you're feeling okay, when you stand up, take great care. If you feel a little bit dizzy, sit down again, and my nurse will take care of you. But any problems, you just call us back. Okay. Yeah, no problem. I'm sure you'll be fine. Just follow the guidelines, and then you'll have no more trouble with that. But the rest of your teeth look absolutely wonderfully healthy, so you're doing a great job. Yeah. Okay then. So take care. My nurse is coming to get you now. All right. Bye bye.